Hello all. Today I am going to discuss one very interesting case of male infertility with my team, and I want all of you to see how we discuss and how we analyze it, because infertility is such a common disease that everybody should know what are the different causes of infertility, right? So I will take over to my team. Team, can you please answer what can be the possible causes of male infertility? Yeah.
The mortality of the
Sperm motility, yes. Sperm motility can be a very important factor.
Stress.
factor.
Yes, stress factors and some psychological factors, especially the negative psychological factors, the negative attributes. Like, for example, somebody is very hostile, somebody is very cruel. These kind of negative thought process can cause male infertility. Very good.
Bad habits such as
Addictions.
tobacco, alcohol.
Yeah, tobacco, alcohol. What else?
Caffeine.
Yeah.
Or use of
No, let us go to drugs.
drugs.
Right? So tobacco, alcohol, smoking, then drugs, maybe brown sugars, and all kind of addictions can lead to poor
Cigarette.
sperm performance. Right? So the sperm count can be low. As you already said, it can be oligospermia, means low sperm count. It can be asthenospermia, means weak sperms. Then it can be oligoasthenospermia. So the count is less, as well as whatever are present, they are also weak. They are poor. They have poor motility, right? So it can be oligoasthenospermia. What else it can be? Azoospermia. Very good. Azoospermia can be an important diagnosis in many of the cases. But then there has to be some other cause of azoospermia. What are the different causes of azoospermia? Yeah, it can be pathological causes like
Undescended testes.
undescended testes definitely can present with azoospermia. Yes. What else?
Post-mom.
Yeah. Let us go. Let us move to azoospermia. Some testicular diseases,
Yeah.
right? There can be testicular dysfunction because of some disease. Some disease which can
Shrinkage
be
of size.
maybe it can be atrophy of testes because of some reason. Maybe injury can cause atrophy of
Yeah.
testes. Let me tell you one case here. We have a boy, young boy, aged about 24-25 years. He had some injury and his testes got atrophied, completely absent. Then we started treatment and his testes are coming back now. So this is something interesting. What can happen with this genetic based medicine? And somebody was saying awareness, isn't it? Awareness is a very crucial factor. Awareness about the sexuality. Maybe many of the I will say not people exactly, the experts now say that the sex education is very, very important. I would like to share one case with you. That patient came to me with 4 years of infertility, and they have went to so many doctors before coming to me. They did all possible treatments. I won't say exact treatment because I don't want to blame any system. It's not about a system. It is about the awareness. So after 4 years of treatment, patient came to me, and we are in the habit at our clinic. We are in the habit of knowing more with the patient, counseling the patient, and getting in touch with the core things in the patient. So we consulted him, and when I talked with that patient, it was an eureka moment for me. Because after discussing, I came to know that patient after 4 years of marriage have never done actual sexual contact even once. Isn't it strange? They didn't know what sex exactly means. What is meant by the actual penetration. So they actually never had actual penetration. How can you think of having a pregnancy then? Isn't it? So that was lack of awareness. It is a rare case, I do agree. But lack of awareness can be a huge factor in infertility. Another thing which can present as infertility is lack of knowledge about the fertile period. I have seen some cases where sexual contacts are not too frequent, right? They are infrequent contacts, and unfortunately, they fall. The contacts, when it happens, they fall between the infertile period. So for patient, what will happen? They will say, we are having contacts, although not very regular, but we are having, for example, 1 week gap, right? And that 1 week gap takes away the fertile period. What do you think? Will his wife ever become pregnant? It cannot be, isn't it? What do you say? Suppose patient should get the sexual contact between that fertile period, between 10th to 15th or 16th day, right? Suppose these 6 days are missing every time, then is there a chance of pregnancy?
No chance.
No chance of pregnancy. Now, why I initiated this discussion is, just now I have examined one patient. Again, 4 years of infertility. After 4 years of infertility, he had all the reports. The reports were sperm count was 80 million. 80 or even more than 80 million. There were 2 or 3 reports. But one was recent report, 80 million. But nobody examines. I examined the patient, and what can be the diagnosis? In this case, diagnosis was there were no testes. Testes were absent.
Then how?
Testes were absent, and the sperm count was given 80 million. I don't know how it is
Fake
possible,
report.
right? No, we don't talk of report. We are posting a video here, but there was no testes. Both testes were absent, and sperm count was given 80 million. And patient now came to me. To be very precise, he came to my wife. Both couple came to my wife because they are unable to collect the semen. Right? So pathologist sent those patients to us, and the conclusion was he never had any semen. Whatever discharge patient is having is slight prostatic fluid which is discharged,
Then how?
and I don't know how the sperm count was there. Right? So there is no testis right from the childhood, and this was the cause of his infertility, and still he has the sperm count of 80 millions. Right? The latest pathologist said that you don't have any semen. How can I tell you about the sperm count? So maybe whosoever the pathologist has seen now is very sensible, very ethical, and lots of respect to that pathologist. I don't know how somebody gave the 80 million reports, right? But this pathologist told you have not given me any sample of semen. It is just a prostatic fluid. If you do not have any semen, how can you have sperms? Right? So we need more of such kind of ethical doctors, more and more we need to have. Right? So it was nice that patient came to us, and then we go into our deep research and examination so that we get to know these findings so that we can help them better. Right? I hope this video was important for you. You can share this video with anybody who is having infertility, male infertility, specifically male infertility. Guys, can you remember some more causes we discussed? Radiations, yes. Mobile radiations. Suppose somebody is the habit of keeping mobile in the pockets, that can heat up the testicles and lead to oligoasthenospermia. Even holding laptop on your lap can be a cause of reducing the quality of sperms, right? That can cause oligoasthenospermia. What else? Diabetes, yes. Diabetes or any other chronic disease, even malignancies can cause, right? Primary cancers and secondary cancers can cause. What else? Anything more you can remember?
Indifference.
Yeah, a bad mental attitude. Please do not underestimate this. Everything may be in place, but if you have bad mental attitude or hostile behavior towards the family aspects, family, wife, kids, if you have completely negative and hostile behavior, then nature will see that you do not get kids, right? So guys, if you feel that this video can be useful for somebody, please share this. Maybe it is going to be of huge benefit for them, and they will bless you forever, right? For knowing such health videos and health information and health knowledge, please subscribe to my channel, and if there is any comment from your end, please give the comments. I will be happy to answer them. Thank you.